So the Health Department has also launched the Vax Champs campaign and has invited everyone that's living in South Africa to become an ambassador for vaccination against COVID-19. So the Vooma Vaccine Champions, essentially, are volunteers who will go into their communities to encourage their friends, family and neighbours to finally get the jab. Over 23 million people living in this country have received at least one COVID-19 vaccination. As the Vooma Vaccination Weekend, that is, draws to a close, let's bring in medical doctor, Dr. Fundile Nyati, who joins us now, at least for what he understands about this campaign. Dr. Nyati, always great chatting to you. Thanks very much indeed for making time. And you'll forgive me falling over the different names. There's Vooma Vaccination, there's Champions, there's Vax. I mean, insofar as this leg of the campaign is concerned, what do you understand to be taking place differently this time around?
Well, thank you, Ayanda, for the interview. Well, what I understand is that, as a country, we are one of the lucky countries where we've been able to access vaccines to protect our nation. We had planned that at least 70% of the adults should be vaccinated by the end of this year. But what has happened over the last two months or so, there has been a decreasing number of people who are volunteering for vaccination. Just yesterday, there was plus minus 77K, people who vaccinated instead of the maximum capacity of 350K. So this, introduction of the Vooma Vaccination Champs is really borrowing from what used to be done during the height of the HIV and AIDS pandemic, where you got community mobilization, you got people to be peer educators, you got people to, spread the word out there. Because sometimes people believe those that they know with information, because there's a lot of mistrust. So this Vooma Vaccination Champs, program is basically saying, let's get all South Africans who can influence others to get those people to, take the vaccine. And we also know that a lot of people are not necessarily opposed to the vaccines, but they don't have the information to address some of their concerns. So the duties, therefore, are for the vaccination champ to educate himself or herself about everything relating to COVID-19 and the vaccines, and therefore use that knowledge to empower and encourage others, and also be, somebody on the ground who is advising and giving feedback to the department as to what could be done better. And so somebody like myself who's been doing that is actually seeing this as a continuation of what I've been doing, and I'm encouraging other people. And you don't have to be a medical doctor to actually be a Vooma Vaccination Champ.
That's exactly where I was going to go. I mean, ironically, what the Vooma Vaccination Champs campaign is trying to do is what should have been happening anyway in our country. So again, I guess it begs the question, how are you hoping this will actually shift the dial?
Well, like I said to you, there are certain lessons that I think are important to learn as a nation. There was a time when people were refusing to test for HIV in the early 2000s until community mobilization, peer education, multi-stakeholder, collaborations took place. And this is exactly what they are doing. And this is a bit late, but actually it still, will be able to turn things around, because we've seen it work. And just, before this interview, you crossed, into Boxback, where there was a Vooma vaccination, situation there. And the numbers there are already showing that if you mobilize people on the ground, you are there to share information, and you don't judge people. You just assist them to address their concerns. People will then be able to do the right thing. And I think we need more of people to be Vooma Vaccination Champs. And like I said, you don't have to be a doctor, because weekly, if you are a champ, you will be able to have access to up-to-date information from the department. And there will also be weekly webinars as well to empower you. So don't feel just because you're not a healthcare professional, you will not be able to deal with the common questions that are likely to come from members of community.
Yeah. My next question is probably going to raise eyebrows in some respects, but I think I won't be forgiven if I don't ask it nonetheless. What's the incentive to be a Vooma champ, so to speak?
Well, I think, and this is a question I also answered a few days ago.
Right.
One of the things that we need to address here in South Africa is that we don't need to always want to get something for us to do something. So I talked about this whole concept of, altruism, where you want to be part of the solution to solve a problem that will benefit others without expecting anything. So the starting point, therefore, is want to be a patriotic South African who wants to be part of a solution of reducing unnecessary preventable deaths, as we have seen with the last 3 waves. That's what is needed. If you want to participate because you want to get some money or something, then maybe you need to ask yourself a few questions. So there is no incentive besides wanting to be part of a solution, and at certain points you may need to sacrifice something, your time, like I'm doing now, and other things, just because you love your country, you love your people so much that you want to make sure that come the 4th wave that's predicted for mid-December and January, they are not victims of that wave.
Better public health outcomes should be an incentive enough, right? I completely hear that.
Exactly.
Let's speak, though, about how we're doing, Doc, with understanding why people are still reluctant, perhaps is the term I should use, to come forward.
Yes.
I mean, in many respects, the evidence, empirical data has even come out in South Africa showing that the vaccines are effective. Do you get a sense that we've come anywhere near decoding the complexity around why people choose to stay away?
Well, luckily, we're a country with very good scientists, even research scientists. So University of Joburg, together with HSRC, they actually zoomed in to look at why the hesitancy. And there are 3 things. One, it's fears about side effects of the vaccine. 2, is questions about efficacy. Do these things work? 3 is mistrust of pharmaceutical companies and the government. So those are the 3 things that the study has shown. And just about on the 4th of this month, Discovery Health, the biggest medical aid administrator in this country, came up with real-life results that actually demonstrate within their membership that these things do work. It saves lives from a hospitalization and deaths point of view, and also it reduces chances of infection. So we've got enough evidence to show, but we now need to decode that information and share it, in a way that an average person who is non-medical understands those benefits without judging them.
Absolutely. Well, hopefully these kind of engagements lead to better outcomes, at least in the near future. Dr. Fundile Nyati, thanks very much indeed for your time. Really do appreciate your weighing in on this important matter.